Hello everyone, hopefully you can all hear me. Let's just wait before we start the demo day for a few seconds until everyone is online. We are still waiting for some people to register. We are just going to wait like a minute or one more minute, and then we're officially going to start, because I can see the names popping up on the attendee list. Just a couple of house rules. As I mentioned to the speakers as well, if you're not speaking, then always please mute yourself. And in terms of questions from the audience, if we were to go there, then again, same things apply, that if you're not talking anymore, always please mute yourself. Andre, you raise your hand. Do you have oops, allowed to talk? Can you talk?
Yes, that's what I was going to ask about the unmuting, unmuting, because I didn't see the option anyway.
Yeah, so you should be able to talk and unmute yourself as far as I can see.
Yes, so yes. I'm going to give permission to talk to every startup representative. So this is just that, like it said, that the audience is not able to unmute yourself, but I'm going to give permission to everyone who will speak today. So yeah.
Okay, good. I think we can start, and if anyone joins later on, then they would just catch up. So a very warm welcome to everyone who came to the V4 Global Expansion Demo Day. This is the big day for a lot of companies, and thank you for everyone who is here to speak today, or to present, or to participate in the panel. And I would also like to say a special thank you to the Visegrad Fund, who was able, because without them, we were not able to organize this. Thank you for your special support coming from the fund. And also thank you very much for Civita Slovakia, DEX Innovation Center, and Startup Hub Poland, because it was them and Startup Campus, and we were the 4 organizations who actually put in then the work and made this program possible to everyone. So thank you very much. I will explain the agenda in a few sentences. So the event is going to be roughly 2 hours long. Legal advisor, which is Marcelo, you're unmuted. Okay, thanks. So yeah, basically the event is going to last approximately 2 hours. We are going to start with an opening remark from Managing Director Greg Guyash from Startup Campus London. Then we are going to continue with a keynote speech from Ewelina Stacherzak, as far as I hope I was able to pronounce your name correctly, from the International Visegrad Fund. She's going to talk about the impact on the V4 region by public organizations. Then we will continue with a panel discussion talking about cooperation and innovation, and it's going to be the 4 organizers who are going to talk in this panel. Then we will continue with another keynote from Marcelo Pascual Morales, Managing Director at MSD Pharma, and he's going to discuss international healthcare organizations in the V4 region. Then we will have a short break. This is between roughly like 3:30 when we will have this break, and then it's only going to be 5 minutes, so don't go anywhere. And then we will have the startup pitching session. And the 8 companies are going to pitch. The pitches have been recorded just to make sure that connection problems and these kind of technical things are not going to get in the way of the pitching. One point of information is that DeepTrait will not pitch. They will just introduce themselves because of the current phase of where the company is in their product development. And after the pitching session, I will just say a few closing remarks. And I would like to ask the jury to stay a bit longer to have our internal discussion with them after my closing remarks. So unless anyone has any questions, I would pass on the microphone to Gergő, Managing Director of Startup Campus London. Gergő, the floor is yours.
Okay, thank you very much, Olivia. Thank you very much for everyone. Nice to see so many people here, especially in these days when everyone has this Zoom fatigue. So as you all know, my name is Gergő Guyash. I am the Managing Director of Startup Campus London, but also a board member of the investment arm of Startup Campus. And basically, in terms of my opening remarks, I just really want to say a few thank yous and also just explain what happened in the past weeks. So basically, our job was to work with these magnificent funders and to help them to be ready regarding their international journey, and also to make sure that they are prepared for today, because they're going to pitch and present their ideas to investors and also pharmaceutical companies, and also many other stakeholders who will be quite important for them later on. Of course, we didn't do it alone, so the program was generously supported by the International Visegrad Fund, aspects of it. So thank you very much again. And also a big thank you to our co-organizers, Startup Hub Poland, Dex Innovation Center, Health Slovakia, who helped us to find the talent and also help us to promote the program, and we together organize an internal demo day to the startups, which was a practice session before the final event, which is happening now. And finally, to our jury members, our keynotes, our presenters, everyone basically who was involved to make this program successful. And also to my colleagues as well, who work restlessly on bringing this under the roof. So briefly about the program. So each participant received 8 online consultancy sessions by experts on globalization and foreign market entry strategy. Topics included like go-to-market, competition, value proposition design, resource management, fundraising, branding, international market entry, and so on. So it was pretty comprehensive. And besides that, 13 webinar sessions were organized. And basically, it was not only available for the 8 participants, but also for a wider audience. We wanted to make sure that everyone could benefit from this program in this region. So that's the reason why we organized it that way. And all of them can be reversed on our YouTube channel. So that's also pretty good. We wanted to create a long-lasting impact with this program, and I think we made a good job. But let the years decide that. And today you will see the result of this long preparation period, and hopefully you will be amazed about where the healthcare sector is in this region. And basically, I think that was all already enough of me, because you will hear like much more interesting keynotes. And I just wanted to say a big thank you again for each stakeholders who were involved. And I wanted to wish everyone a pleasant evening, and also the best of luck for the participating teams. Thank you very much.
Thank you very much, Greg, for the opening remarks. And now I would like to pass on the microphone to Ewelina Stacherzak, a project manager at the International Visegrad Fund. And she's going to discuss basically what kind of impact public organizations such as the International Visegrad Fund have on the V4 region, why it's important to push these kind of collaborations in between these 4 countries, and why we are actually tougher, like our companies in this region, it's a bit more tough to sell internationally than if you would be from Western Europe. So she's going to talk about this, and I don't want to steal more time from you, Ewelina. The floor is yours.
Thank you so much. Good afternoon, ladies and gentlemen. So thank you for the invitation, and thank you for a chance to have possibility to talk with you about the cooperation in Visegrad countries. I would like to share with you my screen. I'm not sure whether it's you can see this. Can you see my screen or not?
Not yet. Maybe if Sophia makes you co-host, then.
Yeah, I have done that. So please try again, and you should be able to share your screen.
I still.
It should be at the bottom. If not.
Oh, yes, I think it's now should works, if perfect. I'm not mistaken. Yeah, it's perfect. My name is Ewelina Stacherzak, and I'm project manager in International Visegrad Fund. And I will give you a bit information about the fund itself, but also about the cooperation in the region, which is supported by fund. So International Visegrad Fund was established 21 years ago by the governments of Czechia, Hungary, Poland, and Slovakia to promote regional cooperation in the Visegrad region, as well as between the V4 region and the other countries, especially in the Western Balkans and Eastern Partnership regions. And fund does so by financing grants and awarding scholarship and artist residencies through its annual budget. And from next year, it will be like, the budget will be 10 million euros. So it's not very huge money, I must say. The fund was created to support civil society in the cross-border context, to support students and scientists' mobilities, exchanges between artists, and join the grant project. And our mission is to strengthen the ties of the V4 and to develop the cooperation between their non-governmental institutions in the field of the culture, education, science, research, tourism, cross-border cooperation, and youth exchanges. And I think the key words for our entity is the fact that we highlight this cooperation, that we highlight this common joint activities or all the participants of the project or all of the participants of youth exchanges or the research, academic research, and so on. So through these 21 years, we have supported mobility of people and ideas by a sum of over 100 million euros. And our grantees has implemented 6,000 projects and almost 3,000 individual scholarship and residences has been funded during these 21 years. It's quite a significant number, I must say, and it wouldn't be possible without a joint effort. I would like to underline this joint effort of all partners involved into the project implementation. All our grants, all our projects, all our researches, and all our exchanges demands cooperation, and these joint activities are visibly enriching our region. And all around the world, we have supported 3,400 entities, which has implemented their projects in more than 600 cities. And to give you a bit maybe more visible opportunity to see how it looks, it is the map where we mark with the blue color all the places that actually not our project, but the project of our grantees and all the institutions that we are supporting are implemented. So you can see this is all Europe and all around Europe, and it is not all the places that we have our project. So the most important part of activities that we are supporting are grants, and we have three types of grants. It's Visegrad grants, Visegrad Plus grant, and strategic grants. And to implement this Visegrad or Visegrad Plus grants, the project must develop meaningful cooperation and active participation of organizations from at least 3 from 4 V4 countries. It means that all these 3 organizations, all these 3 entities must be active in the project, must cooperate in the project, must do this together. And this togetherness and this cooperation, it's the key word to implement the project. And I must say this is very important to project be successful, that all these entities are equally or regarding their capacity involved in the implementation. So they are together creating the project, applying in one of the call or in February or in June or in October, and they together later implementing this project. And it's very similar for the strategic projects as well, with this exception that to develop a strategic project, the consortium must include all V4 representation. So there must be 4 entities from all of these countries. And we can see that visibly that all of us, all of project managers working with entities who are implementing the project, we can see that this cooperation is very, very fruitful and very meaningful. And we can also see this through our team itself, because among our project managers are also people who used to be scholars supported by the fund before. So it's really, you can see that the idea behind the Visegrad Fund is really working, but it's working because this common joint work of all the entities all around the region, but also out of the region, who together implement the project, together share their knowledge, together share their experience, and have a willingness to do so. So this is the last remark from my side. This is what kind of project we are supporting. We have 7 focus areas, and most of the project, of course, it's from culture and education field, but we have also project from the innovation and entrepreneurship area, from the regional development, democratic values, public policy, and social development. So we are very diverse with our support, or actually our grantees are very diverse in their projects. So whatever you feel that you would like to implement such a project, you are always can come to us, and we will try to give you some tools which helps you to do this. So thank you so much for this few minutes. I wish you good luck for your presentation later. Thank you so much.
Thank you so much for the presentation. And we are going to continue now with our panel discussion. And I would like to ask Greg, Michael Stefan from DEX Innovation Center, Eva Simenkova from Vit Slovakia, and Maciej Sadowski from Startup Hub Poland to please, if you don't have it yet, I don't see you, but if just please turn on your camera and your mic as well. So I would start with the first question, which is going to be to Greg. What type of activities need to be initiated that are able to build bridges between Eastern and Western European markets, in specific to the innovation ecosystems, and how can these systematic differences be cancelled? What is your take, Greg?
That's a difficult question, but still, I mean, the short answer for that is education, more educational activities like this program, say for instance, because and besides our regional focus, of course, because sometimes when we see these events, they are pretty focused on the local ecosystem only. However, it is important that we should bring international experts from different countries, say for instance the Western countries or the US or Israel or Singapore, so basically from well-developed ecosystems, because we can learn from these advisors a lot. And you know, we are not in an easy situation because due to a political background and also the history what we have in the region, you know, entrepreneurship was quite stigmatized for a very, very long period of time. And therefore we are lagging behind. And that's the reason why, even if we have like very good talent in the region, the mentality is not there, and it's very, very difficult to keep the standard. And that's the reason why we cannot really show a lot of success stories from the region. So the short answer is the education, but in addition to that would be focus on the export activities, because we need the success stories. We need to showcase that actually we are here. We have like brilliant people in the region. You will see 8 of them today. And actually, but also with these export activities that, say, for instance, many agencies carry out currently, usually even on the regional level, but also on a country level, you know, the preparation and educational element must be added. So that's how I see it. I'm not too sure whether the other panelists will have anything to add, but that's my answer to this question.
Thank you very much. Anyone else want to add to this question? No? Well, then my next question would be to also one point of information from Startup Hub Poland. We have Katarzyna and not Maciej today. So hi, Katarzyna. So the next question would go to Michael Stefan from DEX Innovation Center. Basically, my question would be is the teams in the program highlighted that they often feel that they have a disadvantage in the European market due to the Central and Eastern European region's historical background, and in comparison to Western European startups, they face like a different kind of environment. So what do you think, how can this be changed?
Yeah, greetings from Czech Republic, from Michael. Thanks for having me here. This is a point which I can understand that is coming from the startups, but not only from the startups, quite frequently. But on the other hand, I think this is something that the startup should not really take it as a granted problem, you know, because if we are looking at people from other countries coming to our home country, for example, for playing football or for a visit just, or for some business, I can, from my personal experience, understand that, especially if you are, for example, talking or doing business with some special nationalities, you have some understanding how these people work, what their cultural background is, you know, and they need to do something more in order to get your interest, get your attention. They need to get somehow close to you in another way until you build that relationship with those people, and you kind of demolish the original understanding of the person coming from a specific country. So for example, doing business with people from specific countries, saying that they will send something tomorrow doesn't really mean they will send it tomorrow. So I think that with this specific case, we really have to understand that we are actually entering the markets of other people. Usually the startups from this region are actually going to much bigger markets of Western Europe, like France, Spain, UK, and Germany, of course. And there are people there who are the potential customers, who are the potential partners there, who have some expectations about the people, about the startups coming from these regions. And we have to find our ways how to be even better than the local teams from these countries. This is one thing. If we are comparable to the local teams, then obviously they will have much more preference to work with the local teams. So we have to be better. This is a kind of inspiration for us, that we really have to be better in order to make it on a enemy battlefield in a way. There are other ways which came up from an interesting discussion I was hearing yesterday on our demo day of our acceleration program. Like, for example, if you cannot build the way to the market, which is a foreign one, your own, with your own local people that you might have around your domestic market, try to get a local key opinion leader on that market to help you with the access on the market, right? So for example, if you want to go to Germany, if you want to go to the UK, try to get somebody local that can refer to your business in the way that the local community understands, and give you much more added value in terms of the communication and understanding of your startup there. Also having local ambassadors in those countries helping you with communication of what you do there can help you to really not only build the better position the local teams have, but at least narrow it down and make it more local. I think if we try to understand the way that we are entering another country, another market, and the same is happening to other people coming to our home country, we have to understand we have to be better. We have to get somebody local to help, and we have to be patient enough in order to succeed on that market. So I think, yes, the feeling is there, but there are so many ways how you could go around this, pushing yourself to be better and having some local people to help you with that.
No, I think that's definitely like a good answer, and I think it's also just if we would have someone from, let's say, Vladivostok who wants to who is there a startup and they are great and they want to come to I don't know, Poland or Hungary, obviously you will also want to know, okay, build up the trust, because you don't really meet a lot of people from there, or it's just very far away. So I think it's what you mentioned as well, to have someone local and build up this relationship with them and gain their help in understanding the market better, in terms of the technical things and the trends, but also culturally. I think that's a really good advice. So thank you. My next question would be to Eva Simenkova from Vit Slovakia. So how does your organization contribute to building an innovative and modern startup ecosystem in Slovakia and in the more broader region, in the V4 region, I mean?
Mm-hmm. Thank you very much, Olivia. Thank you also for having me, and greetings from Bratislava, Slovakia, obviously, to everyone.
Do I see it correctly? Is the sun shining, or is that?
No, it's not. It's like snowing heavily, and Daren Wilson from Roche, who I saw, was smiling as well because he's also sitting in Bratislava. So We have the most snow in Bratislava in years today. So no sun shining, right, Daren?
Because it just looked like it. I thought like, that's so strange, but yeah, fair enough. Sorry.
I'm inside, no windows. This is just a lightning, a normal light. So, but I wish there was some sun, I mean, to be honest. So thank you for the question. And first of all, I can relate to that because coming from Civita, which is an innovation consultancy based in Estonia, but we have offices in 18 countries in Baltics, Nordics through Armenia and Turkey as the newest country that we added to our Civita family, I would say. I just wanted to quickly comment on Michal's speech, which was really interesting. And we do many international startup programs, and we also mentor. So let's say I mentor in an Estonian acceleration program, and you know, startups in Estonia have the same troubles, problems, or issues as the Slovak or the Czech startups. But I totally agree that we're no worse than the startups from the Western Europe. Maybe our conditions are a bit tougher, you know, coming from the region that we do. But I think, as you said, we just need to keep going and do the best that we can and learn from each other. And I think this program also helps this. This is what I see as the most important thing, learning from each other and seeing, you know, the differences and helping each other. So I think this program really contributes to this aspect. And now towards the program that we nourish, organize, and do at Civita. So our, I would say, flagship program or a platform that we established just a couple of months ago is called Innovate Slovakia. And it's a platform where we try to help entrepreneurs from Slovakia or from other countries as well to find the support that they need to be successful. And we do it that in a way that we centralize the information, all the information they need on one place, on the platform. We're also trying to show the potential Slovakia has as a birthplace of some successful companies. We're collecting data on investment in startups and scale-ups in Slovakia. And with all this, we're trying to build a community by organizing local events and connecting key stakeholders in the innovation ecosystem. So anyone from any country that would like to set up or establish a business in Slovakia, or just, you know, want to get an idea what's happening, what's right now an important thing that in Slovakia, can just click on the website and we'll find out any information. The other program that I would like to mention is our Challenger Acceleration Program. It's a non-equity startup program based in Bratislava. Currently, we are running green and digital batch, and then urban and creative. And it's open for startups from Europe, from any countries. We had startups from Poland, we had startups from Czech Republic. And it's a program for early stage startups. So, we try to connect the startups with mentors, investors, or various stakeholders from other countries. So let's say a couple of weeks ago, we had an entrepreneur from Brno, Václav, cannot remember his name, I'm sure Michal would know. He has Ysoft venture fund. Well, never mind, I'll remember later. So we're trying to invite guests from surrounding countries, but also from other countries, you know, so the startups, you know, can receive the best information and best mentoring and expert advice. Last but not least is our healthcare lab acceleration program. And I'm also happy that Daren is here because this program, which is supporting or trying to support and grow the international community of innovators and regulators and investors to bring groundbreaking healthcare innovations to market faster. And we do it in collaboration with Roche. And we have received, just today, we had a boot camp, and we were choosing startups who will participate in the program. And we had startups from 16 countries applying for the program. So I think what we are trying to do is to kind of showcase the region. We're trying to showcase the talent that we have here, and we're trying to attract investment from other countries to our V4 region. Because I think even in this program, we see many talented innovators with a global potential. So we're trying to kind of offer them the possibilities and conditions, you know, to grow faster and to enter international markets.
Thank you very much for this answer, Eva. And we would continue with Katarina. So the final question would go to you. And I would like to know basically so in what direction do you see the V4 startup ecosystem evolving? So do you think we are catching up our ecosystem hubs to larger ecosystem hubs of other bigger cities like London and Berlin? And how do you see the V4 capitals, like how do they differ? So are we catching up to the Western European capital ecosystem hubs? And how do we still differ today in comparison to them? What would be your take on this question?
Sure, thank you. Thank you for giving me the floor, and welcome. I'm very glad to be here. Welcome from Warsaw. I think actually my boss and my mentee Mate has already appeared because today I'm kind of speaking as his replacement. So if he wants to join me, then
I'm here with us, guys.
Welcome, Mate. Well, I think there's still a big gap when it comes to the question, but we are very ambitious here as the Visegrad region and European Union itself. So hopefully the situation will be changing, and I think it is changing today and in the upcoming years. Also, European Union does lots to help this cause and sees the potential. It's you can see that in its prognosis and in European Union's prognosis for the upcoming years and like the strategic plans. So I guess and I hope that also the number of business angel in our region will be growing in the upcoming years and make this situation better. And so hopefully one day maybe we'll catch up with the Silicon Valley. Mate, do you want to add anything to me, to my?
Yes, well, Kasia and dear friends, thank you for having us, first of all, and thank you for this very specific question. I know there is no way to provide a very short and detailed answer to such a general question, though I believe the question is absolutely important, and it's maybe interesting for you to know that many skeptics from 2020, early 2020, just after the COVID stroke, were saying, okay, venture capitalism is over right now. Like the problems with investment in high-tech IP-driven endeavors run by funny guys in jumpers and hoodies from our region, it will never happen. Investors will come back to US, Canada, Israel, and other more developed geographies, Great Britain, but they were not wrong. They were not right. They were wrong. The year 2021 proved significant rise in the both numbers and volumes of venture capital investments. Poland, Romania, Czech Republic, Estonia, Hungary, and Slovakia, all these countries developed the number of investments, especially in seed rounds. Fields that are super sexy right now, and especially after COVID, they become probably for next 5-10 years, field of a certain interest of international venture capital firms that are coming from outside. They are not originated in our region, but they are from abroad, from other geographies. We see in renewable energy, in clean tech, we see health tech and nanotechnologies being very, very much investigated by VC due diligence experts. Data protection and cybersecurity, of course. Only in Poland we have several major incidents, so startups right now are being very welcomed by big corporations. I don't need to mention even gaming and entertainment, because this region is famous on this field for 5 or 6 years already. So it's truth universally acknowledged that our region is capable of providing good pool of A-round ready startups in this domain. But for many years, our country was most like ICT solutions, quite incremental, especially for enterprise digitalization. Right now, we see that not only these little projects can happen, but unicornization of startups or scale-ups in the region is going faster and faster. Only in Poland, which was abandoned by unicorns for some reason, I know they didn't like us. Right now, every 2 months we have a new unicorn. It started half a year ago, and there is a discussion how many shall we account into unicorn, 7 or 6, but 3 years ago there was number 0. So I think I'm not sure if together with Kasia we satisfied your curiosity, but again, there is no simple answer. I will just say that if somewhere in this planet venture capitalism can happen and can return on investment, it's probably Central Eastern Europe right now.
Maybe we should have this conversation on Hopin then. It's also a Polish company. I think they are unicorn as well, right? Hopin.
Yeah.
Next time. Okay.
Amazing. Thank you so much for both of you for answering the question, and it's all very
always with you.
You're saying. And we will now continue with one more keynote speech, and then we will go on a very, very short break. So I would like to ask Marcelo Morales, Managing Director of MSD Pharma, to take the floor, and he's going to talk about international healthcare organizations in the V4 region.
Thank you very much for having me. It's a pleasure. Really interesting discussion, right? For someone naive like me on the startup ecosystems. So really interesting. So thank you very much for having me. My name is Marcelo Pascual, and I'm the MSD Managing Director for Slovakia. I came to Slovakia 8 months approximately from US. I think that I share kind of the same vision with all of you around, advanced care and improve outcomes. And to me, it's not anymore, even though I'm in pharma, about the next best product that can come into the market to solve oncology or vaccines, but it's more around our ability to bring together different players with different capabilities to improve patient outcomes and to improve experience. And I have my own user case on that. My sister, who is in Spain, who has diabetes type 1 for many, many years, who has been never able to control that, despite of being on therapy until last year, when in addition of the therapy, she was part of a pilot program to monitor her disease and to use artificial intelligence to predict spikes on glycemia. That was done by a startup in Madrid, in Spain, right? So that combination of the therapy of the pharma and the startup is what has put her in control last year. And I think that that's more and more, if I think about the pharma, the way that we are all thinking, right? About our ability to establish partnership and bring a startup that can offer different capabilities is gonna be key to really address the high unmet needs on the healthcare ecosystem. Maybe I'll give you a couple of words about the MSD pharmaceutical, and then also my own view. And again, a little bit naive view of Slovakia, being here since just this year, right? But maybe to compare with my experience in US or in Spain. About MSD, big pharma from US focusing on research, mainly in oncology. what we aim to cure in the future. And I see my friend Daren, also from Roche, in the call, who is also a big player in the oncology space. We also have a lot of interest in vaccines and other hospital specialty products. We invest quite a lot in research, right, on products, but we are starting to invest as well a lot on innovation, right? And we have funding in the company available also to kind of look for ideas, look for a startup, and then support them on that. That's why this whole thinking, I mean, that I was hearing from all of you is really interesting to see, you know, where you are struggling today and what are the elements that can help to move forward. I think that from what we can offer, right, from Big Pharma here is kind of this know-how, this knowledge about the healthcare ecosystem and sponsorship, right, to support your ideas and our common efforts to address, you know, together many of the healthcare challenges that we see today. If I think about Slovakia specifically, right, I mean, I think that there are challenges today that we see in the dynamics, you know, about aging population, the lack of doctors, that is a strong call for all of us who are in the healthcare sector, whether if you are a startup, whether if you are a pharma company, to go hand in hand together and address those gaps, right? I think that there are challenges that I have seen around the rigidity of the system to operate, but also I think if I compare with the market like US or even Spain, right, like the size of Slovakia and even the before, right, in that sense, I see that as an advantage to move faster and to try to do things quicker than in other places takes quite a long time. So, I mean, I'm gonna stop here to see if there is any questions or comments on that.
If I may have a question, Marcelo, hi, happy to have you in Slovakia. Would you elaborate a little bit more how specifically you work with startups as MSD?
Well, I mean, maybe I'll bring my experience from global, right? But the way that is done there is basically, you know, we propose certain healthcare challenges that we want to address, right? We make them public and then we make a call. And this is happening mainly in US for small companies, a startup, to step in and to propose kind of their ideas. And it's similar of, I think, how is this meeting today set up, right? We invite them for kind of pitch their ideas. We select 3-4 ideas that can, you know, bring a minimum value product, and then we work with them into all the details around what is the funding needed, what are the kind of elements that you need to move this idea from a minimum value product into something more tangible. So this model, I mean, is starting to be cascade, right, in all the countries. And I think that this notion of an idea of, you know, partner and being together to bring capabilities that we don't have in pharma, but other players can bring, is more and more coming into the mindset of all of us, and hopefully as well in the institutions, right, who are part of the system.
Thank you.
Any other questions from the audience? If not, then I just want to make an announcement. I don't know if you have seen it in the comment section, but Mark from Berlin Partner mentioned that they're very much open to collaboration. In fact, they were also sometimes participating in our other programs, and they are a great organization to contact if you would want to expand to Germany. As you can see, he put his email address here. So thank you very much, Mark, if you're not, or if you're still here with us. If not, then hopefully as many people as possible are going to contact you. So now, thank you, Marcelo, again for this very good keynote as well. And we are going to go now until 10 minutes before 4 o'clock on a very short break. And then we are going to continue with the startup pitches. So in 5 minutes, we will continue, okay? Well, it's the 5 minutes are up. I hope everyone is slowly back. Let's just wait 1 more minute before we continue, just in case someone is still doing something and running back to the laptop, then they can sit down. Right, so hopefully everyone is here, and I'm going to share my screen and share the pictures. So we are going to start with HAIDI, and I'm going to play the pitch. I'm going to share my screen, and then the investors can ask the questions afterwards. Right, sharing my screen. Who can share? Wait 1 second. Yeah, there we go. Right, can you see my screen?
Yes, it's working.
Perfect.
Yes, yes.
When you go for a planned surgery to a hospital, the last thing you wish is to get an extra infection while you are there, in your wound or COVID from your roommate. But this is exactly what will happen to 22 patients within the European Union in the next 3 minutes of my presentation. They will get this kind of infection, which is called a healthcare-associated infection, or an HAI, and one of them will most probably die due to this condition. This sums up to a total of 4 million affected patients in the EU every year. But despite this fact, hospitals really struggle with collecting accurate data about the incidence of HAIs in their facilities, which significantly limits them in their ability to target preventive measures effectively. And thus, the healthcare systems must pay around 20 billion euros in extra costs every year. But don't worry. If we change the situation and collect the data and target the preventive measures effectively, we can prevent a lot of these infections. And that's the reason why we have built HAIDI, an AI-based software solution for automated surveillance of healthcare-associated infections that completely changes abilities of hospitals to combat healthcare-associated infections. HAIDI automatically reads all available electronic health records, including free text clinical notes written by physicians and nurses, understands it, and extracts relevant information such as symptoms, diagnoses, lab results, medication. And based on this information, it detects potential HAIs and their associated risk factors. HAIDI delivers accurate and real-time data about the incidence of HAIs in hospitals that were not previously available. It has proven to save up to 90% of time needed for the manual surveillance that was in place before HAIDI was deployed, and uncovered up to 5 times more infections than the same manual surveillance. Since the official launch in 2019, we have been able to acquire more than 10 paying hospitals with full implementation of HAIDI in Czechia, Slovakia, and Austria. HAIDI receives great feedback from its users and generated several advocates among them who actively promote HAIDI within their network and community. They do it because HAIDI is easy to use, understands clinical notes, easily integrates with hospital information systems, and provides useful insights in infection prevention. These features, combined with limited competition operating mostly in the United States, give HAIDI a unique opportunity to become the standard for data-driven infection prevention. HAIDI is an on-premise software with subscription-based licensing model based on the size of the hospital and its geography. We aim on being in 100 hospitals within the next 3 years and generating about 5 million in annual revenue. This wouldn't be possible without our extraordinary team that combines strong technical skills with business experience. The technical skills come from large data projects, including healthcare, and the business experience from our hands-on investor who's a serial entrepreneur, and also from our business development team. Currently, we're looking for partners that would help us with scaling HAIDI into foreign markets, especially to Germany. We look for any kind of partnership that would be beneficial for both sides. So if you're interested in joining us and saving the 22 patients within the next 3 minutes, I will be happy to talk to you. Thank you.
So thank you very much. If you can share your yeah, you already, Mikołaj, you already shared the, oh no, sorry, that's the idea, sorry about this. So yeah, if you can just please share your, sorry, camera from HAIDI, and basically the investors, do you have any questions to Jakub?
Yes, I have a first question. Hi, this is Mikołaj Gurdala from EIT Health. Can you tell us a bit more about the certification of your algorithm? Basically, how does it work? How does it has been trained on the data, and whether you have certificate? And secondly, you mentioned you want to scale to reach more clients. So I would like to just understand which are the markets that you're heading to at the moment.
Mm-hmm. Okay, thank you. I hope you can hear me. I cannot switch on my camera. I cannot see it anywhere, but probably never mind. So what kind of data? It's so the models used within HAIDI it's a combination of expert systems and machine learning. The reason for starting with expert systems was that there were no training data available, basically for the start to train some advanced machine learning models for predicting the occurrence of healthcare associated infections. So that's the reason. Secondly, we do not have certified HAIDI as a medical device regulation yet. From this point of view, it's a rather retrospective analysis, which does not have to be certified. But as we are moving towards more predictive features, we have started preparations for being certified according to the MDR regulation. And the last thing, for the target markets, now we are focusing on expanding into German-speaking markets. So we have signed first customer in Austria, which should be our starting point, and moving from Austria also to Germany. We are also, of course, operating in Czechia and Slovakia, but our main goal is to get into Germany for now.
Did that answer your question, Mikołaj? Or yeah, good. Daren, do you want to continue?
Thank you very much, and really appreciate the innovation you're bringing to try to identify healthcare infections. Two questions. One question of curiosity: what limits you at infections only? How have you thought about working with the data to maybe move towards also detection of treatment-related adverse events for broadening out the product? So I'm just curious on that, if you have any additional ideas of expansion. And the second question is, as you're looking to scale into other markets, how have you looked at the challenge to be able to integrate into different hospital healthcare systems in order to apply your solution to different electronic health records?
Mm-hmm. So yes, we are thinking intensively about building new products on the platform. So this is a first use case for us, the infection prevention. And we have, as we received the feedback from hospitals, they're asking for a new potential product. So we are now broadening our scope into other fields, as you said, other adverse events and risk assessment of patients, basically, from various points of view, like pharmacotherapy, like clinical pharmacy, orthopedics, screening for before surgeries, etc., etc. And the second, which and the reason is that this should bring additional revenue without having significant additional costs for sales and marketing. But the second question, the integration with hospital information systems is is an important thing. We have partnered with the major vendor of hospital information systems in Czechia and Slovakia, who is now providing an interface to their system, and we're planning to continue with this in the next markets. We believe that these partnerships or abilities to connect easily to hospital information systems is a key point on being able to sell quickly into hospitals.
Great, thank you very much.
Thank you, Attila.
Thank you for your presentation. My question will be related to your market, short term and also long term. So you mentioned your benefits compared to just regular manual solutions. How about other software or integrated software or just AI-based solutions similar to yours? So are there any direct competitors that you've identified, and how close are they to your solution? What are the main obstacles for them if they want to just keep up with your solution?
Mm-hmm. Yes, I compared mostly with the manual surveillance because that's the standard that's done, for example, in Czechia and Slovakia. They do not have any specialized softwares here. There is one direct competitor in Czechia who's claiming to have similar software. For us, the main benefits are that we are able to provide it as a on-premise solution. So it's the first thing which a lot of hospitals appreciate. The second thing is we have this partnerships with hospital information system vendors that makes us which makes it much easier for them to connect with our system, less cost and less work that has to be done on their side. And we have other other features like this risk factor analysis that they do not provide. And there's one more competitor on German market for the hospital hygiene, but this is rather for evidence where the hospital hygiene staff must enter their own data and their own records, which means like a lot of work for them and does not have the capabilities of HAIDI.
All right, thank you.
Right. Are there any final questions to Jakub? If not, then one point of information is that the reason why you were not able to turn on your camera is because you have to accept being promoted to panelist. That just goes out to the rest of the startups. Just make sure that Sophie has sent you the request, and then if so, then please accept it if you haven't done it so yet. One more thing that I have missed out is to introduce the jury. So the jury panel. So please, thank you very much for Daren Wilson, General Manager at Roche Slovakia, Tomas Vavrecka, Country Manager at Philips Health System in the Czech Republic, Mikołaj Gurdala, EIT Health Ecosystem Lead for Poland, Vit Hanus, Investment Partner at Zero Gravity Capital, and Attila Khader, Investment Director at Startup Campus. So thank you very much for everyone who is participating in the jury. And we are going to continue with Stemi Global. I'm going to share my screen now and play the presentation. Oops, 1 second. Right, that should work. Okay.
have bad news for all of you. Every third one of you will die of heart attack or stroke. My name is Andre, and I'm the CEO of Stemi Global, the company that saves lives in medical emergencies through innovation and technology. This is my father and me when I was 6. It was a time I almost lost him because the system in medical emergencies works like this. For example, in heart attack, the ambulance crew arrives and make the diagnosis and decisions. Often wrong ones, as paramedics are not cardiologists, sometimes not even doctors. So they go to the nearest hospital, where cardiologist makes another ECG and send the patient to cath lab. The doctors do examination all over again and call his team for operation. And finally, the patient gets his treatment. My dad was lucky and he survived this stroke. There are 100 million heart attacks and strokes annually, of which nearly 16 million people die. The amazing thing is that almost half have delayed treatment. We created a communication platform you can see available on phones, tablets, and PCs that helps by connecting the doctors, let them decide about the ideal transportation, let them share critical data, prepares the team in hospitals, and gives COVID early warning system about incoming patient. The solution has been tested in all ambulances, cardio, and stroke centers in Slovakia, and the result is great, as we managed to cut the chance of immediate death by 50%. There is a clinical study about it published in the US. We calculated that only about 7% of all eligible hospitals have similar solution already, and so market looks still attractive. The estimated market value is around $4 billion annually. And let's not forget, the hospitals are like banks 8 years ago in dire need of digitalization and modernization. There is a competition on the market, but no major player with large market share has emerged yet. I know we are better than most, as we are the only one having clinical study about the results that we can deliver. We have a fast implementation and product can be used within weeks, and we provide comprehensive statistics on performance of wards, hospitals, or regions. The plan of our growth is based on our current new clients in our sales pipeline, on our planned regions we want to enter, and on our new development of AI-based diagnostic tools for doctors and patients that will allow for higher turnover per customer. We are raising €2 million that will let us finish our product development and give us chance for global scale. I believe that we have a perfect team that covers technical, financial, BDM, medical areas, combining over 100 years of experience. I would like to highlight Martin Topride, our co-founder. He's an invasive cardiologist, and he came with the idea of such app to minimize delays. Our advisory board includes expert in marketing, business, other medical fields, and also for AI development, we have a professor from UC Berkeley. We have some recognition and some awards, but the most important is that we want families to stay together, not because of luck, but because of fast diagnosis and treatment, if such situation arises. And we know it will, and we hope the third person lost life can be saved. Thank you. Bye.
Thank you, Andrei, for the amazing presentation. And now going to the jury panel. Any thoughts, any questions? Or was the presentation so good that it answered all the questions? I see, Daren, you raised your hand.
Yeah, thank you. So I just want to first compliment you on being innovative, addressing a major unmet need, and then obviously having the clinical trial results to show the advantage. I think that positions you well, and it's clear with the team and advisory you have behind you. I'm just curious, besides money, what is the greatest challenge you're facing right now in order to scale?
Well, it's the partnership with in other continents. We feel quite confident to expand throughout the Europe or regions we know. But we just started pilot, for example, in Oregon, in Klamath Falls, and it's quite challenging to find out how the local healthcare system works. Or, for example, we are starting in Brazil, where it's completely different system, and even the countries are split into the republics with different authorities. So it's I think the biggest challenge is actually the research, and the ideal situation if we have some partner in the region that help us to expand and make it much faster.
Okay, thank you. I can imagine you require local ecosystem partners to help you to navigate and set up. So
yeah. Once you move out of to the other continents, it's a completely different playing field, and working with the local partners proved to be the right way.
Okay, thank you.
Thank you very much. Attila, you also raise your hand.
Yes, so thank you for your presentation. My question would be, what kind of entry barriers you recognized on, especially on the European market or even on the global field, when you are trying to just reach new countries, new regions with your solution? What are your biggest obstacles?
Well, fortunately, the product as it is now doesn't require any certification, so that's quite easy. We stay as a communication platform, but biggest challenge was COVID. I think on one side it opened actually the door for us to communicate with people throughout the world. Like new pilot started in Indonesia, and suddenly people that are managers of the hospitals and cardiologists and doctors are able or willing to go on Zoom and communicate and have discussions, which was impossible before. On the other hand, the COVID has stopped a lot of progress in our pilots and decisions because the healthcare was so overwhelmed in the countries that implementation of any new technology was basically stopped or paused till the next wave stops or goes down. So it was one side, it was good, it was a blessing because it allowed us to communicate, but on the other hand, everything is much slower.
Right, yeah, I agree. It's something our portfolio companies also experienced in the past year. Thank you.
Yeah. Welcome.
Thank you, Thomas.
Yeah, hello, Andre. Great solution, and thanks for presenting this one. Similarly to Attila, I would be interested on the way, if you can say a bit more, how you actually offer this solution and who is your main customer.
It differs from country to country because, for example, in Greece, we are in communication with government. Same for Egypt, because they have a nationalized healthcare. So through our partners or through local distributors or through our own contacts, we try to get to the local decision maker or somebody who is able to push us to the decision maker. And for example, in the US, but there is no national healthcare. We target individual clinics, individual hospitals, where we are able to find contacts or find partners that has a contacts to those places. So usually it's a referral that works because the cold emailing or LinkedIn hasn't proved very efficient. So it's looking through the partners, basically local partners that have a contact.
Okay, thank you.
Any final questions from the jury? If not, then thank you very much. And we are going to continue with Medistance. So Fruzina, just be ready. And I'm going to
thank you very much.
And I'm going to share my screen in a second. Right. So Medistance, where are you? There you go.
Hi, my name is Fruzina Mezei. I am a health economist and the digital health leader of Medistance. Today, I'm going to give you an insight into why utilizing health status data is important and what big pharma and healthcare providers gain from implementing a health data management solution. About 80% of all healthcare data that's generated during care is inaccessible for further medical decision-making. Medical professionals often don't have access to the necessary insights to make accurate diagnoses and decide on the most effective treatment. As a result, patients aren't getting the treatment they need, and they are forced to come back to the doctor to reevaluate their condition and treatment plan. This does not only lead to 112 million excess costs for the healthcare payer, but to 60 million premature deaths due to not adequate treatment each year. This is the issue that we are tackling at Medistance. Medistance is a solution that collects, manages, and analyzes real-time health status data directly from clinically proven medical devices. With Medistance, healthcare professionals can better understand disease progression, support therapy optimization, and lower the cost of treating each and every chronic disease patient. The system works with clinically validated medical devices from well-known brands such as Omron and Medicine, and measurements are collected through a data transfer hub that delivers the values to a GDPR-compatible database. Users can analyze the data by preset algorithms and models in geographical, spatial, temporal, and cost dimensions to help therapy decisions. Our main customers are pharmaceutical companies and healthcare providers. For pharmaceutical companies, we provide anonymized real-world evidence on efficiency of their therapeutic agents. For healthcare providers, we provide an end-to-end remote monitoring infrastructure and real-world data for treatment optimization. In addition to the non-monetary value, healthcare providers can reduce their costs related to care by 31% within 3 years of implementing Medistance by avoiding complications and unnecessary patients visits, while pharmaceutical companies can increase their box sales by 18% only by supporting their sales and marketing activities with real-world evidence on existing drug agents. We already have several long-term clients in Hungary and also have some in the pipeline for the upcoming years. Our current goal is to secure our first customer in Poland and Romania by the end of 2022. By 2024, we'd like to set foot in Germany, India, and the Visegrad 4 countries. Compared to similar solutions on the market, we customize the infrastructure to the disease group that aligns with the customer's exact goals. We have super fast data processors, analyze and report real time, and can expand the infrastructure up to data collection from 10,000 devices. Approximately 75% of this year's income is coming from pharmaceutical companies, which is why we'd like to prioritize expanding into this sector. With our priorities set straight, we are expected to achieve 2 million euros revenue by 2025. We are currently looking for an investment of 3 million euros, which will be mainly spent on expansion. We are also looking for partnerships, on one hand with distributors, and on the other with research entities for real-world data research projects. We have a competent team behind our solution, combining nearly 100 years of experience in fields of medical device sales, field medicine, digital health, and data analytics. We also have global partners standing behind us. With their support, we can provide an even more robust and secure service for our customers when expanding abroad. Let's partner up to create more optimized therapies and reduce the 60 million premature deaths to zero.
Thank you very much. So, who wants to start with the questions?
Hello. I can go. Okay, just go ahead.
Vit Hanus speaking. I'm sorry. Thank you for the presentation. It's a very good presentation, a very exciting project. I have to say that with the traction, partnerships, and so on, which you already have, it's a very impressive project. I have two questions eventually. The first one is that you mentioned that out of these 3 million euros, the majority will be spent on the expansion. How you want to do the expansion? And basically, what are the activities which you need to do for doing it? And second is that you have quite impressive partners, and what the partnership currently is about, whether they are your resellers, whether they are active in the sales activities or expansion, or whether those are more or less the research partners in the algorithmization, or what is their involvement?
Thank you for the questions there. Both of the questions are very relevant. So the partners are present. They are part of our solution. So SAP is our biggest partner. They are also part of the sales, a bit of the sales in different countries. However, their solution is basically integrated into our database. Then there was Health Systems. They are providing the SIM cards, so the whole network, how the data transmission goes. That's based on them. They are a partner for that. And then TechWave and and obviously Omron is providing the medical devices, and then TechWave is our global technological implementation support. So if any large projects come in any of the countries, TechWave is globally present, and they help us to implement the project in a secure and fast way. So we always have someone there if anything goes wrong.
Thank you. If I just clarify, did you experience any lock from being in partnership with these big brands? Because I can imagine that some of your potential clients might prefer not partner with some of these providers. Did you experience any complications or lock because of having such a strong involvement of your partners in the solution itself?
Yes, again, very relevant question. I think not that much on the market. However, once we moved to the governmental sphere, yes, we did, absolutely. So even here in Hungary, we try to get involved in national projects, and sometimes we got rejected because of these partners. So absolutely, I think this wasn't an issue so far. So we agreed with them in another way and made it work in another way. So ultimately, it didn't result in us losing any business, but this has definitely been something that is to consider for us, how to deal with these kind of oppositions. Absolutely.
Mm-hmm.
Regards to your first question, could you please repeat that, because
that was just a quick one, because you mentioned that majority of the proceeds shall go into expansion. I wanted to ask, like, what does it mean, the expansion? Like, what can we imagine below this, proceeds, and how shall that be monetized? Like, what are the activities which you want to do for the expansion itself?
Yeah, absolutely. So obviously, the first and the main activity would be our presence on the market. So this we would do by first of all by looking up partnerships and working with local ambassadors or key opinion leaders in the market. But also, the majority of these funds would go to trying to be present, first of all, as ourselves, like as the Hungarian entity, on conferences with even, so as I said, we are looking for research partnerships as well. So funding these opportunities, I think, would be a great entry to the market.
Understood. Okay, thank you.
Hi, thanks for the presentation. I have a quick question more related to let's say your business development in the future. So let's say you presented this you're reaching for this 3 million. You're going to explore the other countries and markets, but basically, are you going to plan to, let's say, to be a standalone solution, or at the same time you're also planning let's say a partner, maybe even acquisition? You mentioned, for instance, IQVIA or other companies. So is that the field, or maybe working directly with one of the big pharma companies? So what are the thoughts here and ideas? Thank you.
Thanks for your question. Currently, we are a standalone solution. However, we are looking into the idea and the possibility of not being a standalone solution, and maybe partnering up with big data providers like IQVIA, what you mentioned, we would work with IQVIA as kind of like an umbrella organization, because obviously, and most of you who are from the pharmaceutical sector probably work with IQVIA. So we would kind of go in with IQVIA to potential customers and provide our solution under the umbrella of big data providers. So absolutely, we have been thinking about this solution as well. Thank you, Mikołaj.
Thanks.
Okay, thank you. So obviously, the future of healthcare is data. So I think you're obviously in the right space. Two quick questions. My first one is, to what extent have you validated the data towards real world outcomes in order to justify the inputs that you're having? So that's one. And then the second one is that albeit you're working with a GDPR compliant database, to what extent do you foresee yourself able to correlate outcomes towards specific clinical attributes or patient characteristics in order to have a better understanding of the data that's provided?
Thank you for your questions. So in regards to your second question, I think it's what can be seen is that for pharmaceutical companies, because you're from Roche, so I guess you're asking from that perspective. We provide anonymized data. However, we have several studies, ongoing studies with pharmaceutical companies where we include different components, still anonymized or pseudo-anonymized, anonymizing patients. So obviously their privacy is not, or their privacy is protected. However, we try to connect it to either to data from other data providers like IQVIA or like data from National Health Insurance Fund, where we can actually go on to much more concrete outcomes than just from our own database. So this is something that we are working on, and this definitely has a lot of potential, because once we do this, or in case we do this, and as I told you, there are some ongoing projects already where we are working on connecting some databases to match our data. I think once this opportunity opens up, we can not only use our data set for pharmaceutical R&D or therapy optimization in itself, but also for like actual research, let that be epidemiological or whatever. So this would open up huge opportunities for us, and this is definitely something that we want to do. The only issue here is that well, first of all, to align interests of different players, and then once that's done, getting the funding for these studies. And regards your first question, you asked how we validate it to real world outcomes. Can you elaborate on that, please?
Yes. So are you correlating your results to the actual outputs in the hospital? So to be able to understand that the results you're getting actually represent real world. So I'm just wondering how you validate the data to correlate the accuracy, that's all.
Okay, so currently we do not validate it in regards of hospital data. So we do not use any medical records to validate these, but this is mostly because we cannot do it as we don't know who our patients are. So we basically measure their values. We know what treatment they are on. However, we do not have any information on their journey up to there or from there. And I think this is again a point where we can grow and where we can elaborate on this solution and also work together and validate it to hospital data.
Thank you very much.
Tomas?
Yeah, thank you. I have a very simple, pragmatic question and plea to you, because you were talking rather about pharma, how you can use there the solution. I would be interested, because you mentioned during your presentation that this is valid also for care providers. In terms of treatment optimization, easing the feedback collection and so on. So can you give me a kind of example how this is working?
Yeah, absolutely, and it's really interesting because we started off as a provider for healthcare provider for hospitals and clinics and GPs mostly, and I think the easiest way for you to understand it is the classical telemonitoring scenario. So clinics receive a set of devices depending on what's their focus, or hospital departments. They give out these devices to their patients and monitor their health status remotely. adjust their therapy remotely, etc. And in this case, our solution works kind of as a decision support solution for the healthcare workers, and also as really it helps therapy optimization processes.
Okay, thank you.
You're welcome.
Any final questions, or if not, then let's move on. Thank you very much for all the questions. Then let's move on to Neuroconsan. I'm going to share my screen.
Hi, my name is Zuzana, and I'm the CEO of Neuroconsan, a company trying to discover digital biomarkers of brain disorders. Actually, what we do is the earlier detection of patient diagnosis and treatment of brain disorders. Here you can see the current journey of a patient with a brain disorder. It usually starts with some unspecific first symptoms. The patient usually looks for a GP. And what is interesting, 21% of patients saw their GP 3 times before being referred to a specialist. After that, if they see a specialist, for example, a neurologist, 26% of the patients had initially an incorrect diagnosis. This means a lot of lost time for the patient without correct treatment. The number of patients with brain disorders will double by 2050. This means that this problem will stay with us for some time, and we have to really focus on the correct diagnosis and treatment. The main question is why this is happening, like all the errors, and the answer is simple, because we are human and we make errors. We do the diagnosis with the naked eye, with the help of this hammer, which is quite old school, and the assessment is subjective and inaccurate. That means that it's influenced by our mood, by our impression. But we can definitely do this better. We can make it objective. We can make the diagnosis and the detection earlier. And of course, we can accelerate the correct treatment. This can lead to fewer doctors' visits and examinations. And of course, it can lower the healthcare. We offer the digital solution. That means that we install a sensor with a computer containing our software into the office of a doctor, so he can assess the patient more objectively and have the digital biomarkers of the disease. So the changes in the patient journey are here. It starts anywhere from the GP. So the treatment and diagnosis can be correct, and we can save the time of the patient. We don't have a direct competition regarding the movement. They use the markerless system. With the APDM, they're also focusing on brain disorders, but we can rent the hardware, which lowers the cost. And we offer 3 modules, which offers a more holistic approach to the patient. Here is our pricing example. So we use modular system. So the more modules you buy, the better the price gets. And we're happy to scale it flexibly up and down to the needs customer. Our journey wouldn't be possible without this really nice gentleman, without our team, who have long expertise in their field. And our journey is currently in the state of MVP, which is clinically validated in the university hospitals in the V4 region. And from the next year, we would like to expand and we would like to enter the market, which means that the majority of our expenses will be associated with entrance of the market and also with the research and development of the system per se. For partners, especially in academia, in terms of the research projects. And we're also happy to be part of the clinical trials in pharma and medtech. Thank you very much.
So I see already some hands being raised. Vit, do you want to start?
Thank you very much. I have one question, which is about the business model, because to me it is not clear like why you are mentioning and starting with the rental model. Because if I'm a general practitioner, I assume that I will need this hardware and software and so on for long term. I will need it probably forever if it really works and so on. So that's my first question. And the second one is, what kind of data are you using for or what kind of procedure to really assess the disorder, and what is the quality and precision?
Hi, everybody. Thank you very much for the question. So regarding the business model in terms of the medtech devices, there is a long way there to get to the final product. So right now we are considering to implement our solution into clinical trials. So mainly our first customers are planned to be the pharma and medtech companies. So this is why rental, because the clinical trials are planned for some time. So this is the answer for the question 1, and the answer for the question 2. It's a matter of IP, but I can tell you we are measuring speech or voice, we're measuring gait, and we're measuring cognition. So these 3 entities are the domains with which the patients with brain disorders have problems. That's why we're focusing on them. And of course, we are comparing them with the gold standard for all of them, because that's the way the science goes. So
what is the current precision or quality from the tests which you are doing?
So if we take walking and we take, for example, step length, so how big is the step in comparison with the gold standard is 94%.
Okay, thank you.
You're welcome.
Daren?
Yeah, thank you very much. So Susanna, I mean, I have a sister who has a brain tumor, so I can really appreciate the effort that you're taking to bring some advancement here. I am curious because with the Neuroconsan, well, I have 2 questions on this, but the first is, how do you differentiate between brain disorders and neurological disorders, such as how would you suspect someone for glioblastoma versus suspecting someone with Duchenne's muscular dystrophy or MS? Because the measures you're trying to identify, they're relatively similar in many respects across these diseases.
Well, me as a neurologist, I'm aware of the sensitive fingerprints that the disease have. And if you take our holistic approach, so that means cognition, speech, and walking, you really can differentiate between Duchenne disease and glioblastoma. Because in glioblastoma, it's usually on one side and the other side is affected, so it's more asymmetric. Whereas for Duchenne disease, it's more like a muscle problem. So you can see on the data the difference.
Thank you. And then how, because your startup's called the Discovery of Digital Biomarker. Mm-hmm. How far away are you from where you feel you will have validated digital biomarkers for brain disorders, or do you have them already? I think it sounds like you're still in exploratory.
Well, I think it's a long way there. So we have some digital biomarkers there that are making the diagnosis clear. So we are getting there, and we have some of them. And it's basically like there is no limit in that, because you can always find new and new algorithms and new data.
Okay, thank you. So it does sound like your next step is still more moving into the clinical trials for validation, correct?
Absolutely, yeah.
Okay, thank you.
Thank you for the question. Any final questions, Mikołaj?
Yeah, I have a quick question. So, Zana, when it comes to giving the support to general practitioners, so are you planning also to get certification? Because I'm assuming at a certain point when looking at the patient journey, this is going to be a decision support system. So
exactly. Yeah,
if you're planning, yeah, so, okay, and when you're planning to have this certification?
We already started the application, and it's a long way there. So it's probably next year or the year after for the class 1.
Okay, so I think that's going to be quite important, especially also to what Daren said, because then you need to have a clinical data for this.
Absolutely.
And this would definitely help you to acquire additional funds for the further development.
Yeah, I think we need more and more data, and due to the COVID, it was kind of suspended. So yeah, but absolutely.
So thank you very much. Any final questions, or if not, then let's move on, and we are going to continue with Sineko, and we will have David representing Sineko. So let me just share my screen.
Hi, I'm David from Sineko. Have you ever been in a situation when you went to your doctors, got a medical report, went home, started Googling, and you found out that you have cancer? Well, I presume some of us has been in a situation like that, but hopefully none of us had a very serious illness. We just couldn't really comprehend the medical report properly. We started investigating this phenomenon and found that most hospitals cannot even keep up with their reporting requirements alone. We found that the diagnostic and administrative workload is getting higher and higher, especially on the field of radiology, where 97% of radiology departments are unable to meet their reporting requirements. There is little or no innovation on this field, so these departments started outsourcing some of their medical reports to the so-called teleradiology centers. We further investigated the phenomenon and found that the bigger the workload gets, the more difficult it gets to get those reports right. Radiologists misinterpret around 5% of all radiology studies all day, accounting for 40 million times each year globally. Just as a concrete example, the rate of radiologists misdiagnosed lesions on X-ray images that are later diagnosed as lung cancer is in the range of 10 to 90%. These misdiagnoses account for more than 400 billion euros in wasted costs just in the European Union. We cannot solve the problem of increased workload, but we can make the system more efficient. At Sineko, we are developing a software called DeepTrait that is a structured reporting software that helps medical professionals create reports faster in a standardized and translatable way. Instead of typing redundant sentences hundreds of times a day, the radiologist can easily select any lesion on our standardized reporting templates by clicking, dictating, or by just filling out simple questionnaires. This will generate fluent reports automatically and contributes to a very highly valuable detailed database that can be used for further research. What is more, at the end of the process, radiologists are also asked to label the images that they have reported on. This leads to create highly structured labeled images that can be later used for image recognition AI algorithms. Although the problem seems quite obvious, nobody could solve it so far. There are plenty of players and approaches on the market, but our competitive advantage highly relies on our highly structured output. This enables us to create reports faster, in a more standardized, more fluent, and translatable way. Sineko's main road to market is direct sales to research hospitals and teleradiology centers. But to scale this model up, we have been also considering white labeling our product as a hospital infrastructure system provider point. We provide value to many segments of the market. Firstly, by creating highly structured data, research hospitals can improve their efficiency, use the data for research, and avoid misdiagnosis and save costs. Secondly, we offer value to teleradiology companies who can translate the outsourced reports with just one click of a button, fostering cross-country medical reporting methods. Thirdly, we provide value to other segments of the market with our highly structured data, since the anonymized labeled images and structured data can be sold to AI companies, pharma, or even insurers. We are currently in the phase of market validation. We have already done 3 significant pilots and secured our first revenue last year from Armus. We are currently working with the Zurich University Hospital and co-developing reporting templates. In the last couple of years, we have created the structured reporting engine and grammatical rules for 3 languages. Our current goal is to develop a research module and start selling to the DACH market. The core team consists of experts from the field of medicine, health tech, cloud, and development. However, we have been trying to fill in our gaps of the competence of our advisory board, mainly from regulatory and business side. We are currently seeking for €500,000 of investment that we want to use for product development and the DACH market entry. Thank you very much.
Right. So, who wants to start the questions? Daren?
Thank you. So obviously, again, addressing a major unmet need for structured reporting and being able to manage the data. I was just curious, and maybe it was in your presentation, but it wasn't clear. What's your thinking around the data ownership and how you're managing that? Because I sense that you have one business model that is the reporting, but are you also looking at another business model that is supporting the cultivation and utility of the data?
Yes, so just to clarify things, first and foremost, we provide value to research hospitals and teleradiology centers. So that's our main direction that we want to go to. And as an output of that service, we create labeled, highly structured data. The ownership of the data belongs to the organizations that are creating the reports. So in this case, to the research hospitals and to the teleradiology centers. And the data doesn't leave those places because we are integrating there in place, and the data is saved into their already existing hospital infrastructure system. So what we have been thinking about, because we have been doing 3 pilots already, that these hospitals that we have been working with, they are very keen on developing and using this data further. So for instance, with the University of Zurich, the University Hospital of Zurich, we have been using that data with a university that is collaborating with the hospital to create AI algorithms. So for that purpose, we can either buy the data from the owner of the data, or we can create and collaborate on that and move further and develop methods that we can foster highly structured data creation, and then maybe help the hospital find the right partners to make use of the data.
Maybe just to quickly follow up, do you foresee your business plans in actually establishing closed or open data lakes as you start to bring a structured approach to data throughout the European Union?
Sorry, I'm not sure I got exactly the question.
Well, do you foresee in the ideation of your offering the opportunity to build data lakes to bring the data sets together, whether it be closed data lakes or open data lakes, and in support of the European health data strategy? I was just curious if this is a future benefit of your organization.
Yes, definitely. We have been ideating about this, and we have also seen initiatives from the side of the European Union. Also a lot of public tenders that are using this data, and also applying for programs where we are kind of collaborating with companies like Roche or GE or other big players on the market that are in need of structured data, and we can together create something with the data lakes, and then of course utilize the data for further purposes. Specifically with Roche, we have been talking with some people on Navify. So they have been doing tumor tracking, and our solution complements Navify perfectly. So for this kind of tumor tracking solutions or drug development purposes, our solution is perfectly able to complement the companies that are working towards this or create social value as well.
Thank you. I think you're saying buzzwords that are interesting to the investors. Thank you.
Great, thank you. Mikołaj?
Hi, David. Nice to see EIT Health alumni in this competition. A quick question, because let's say I'm really curious how you're planning to tackle the very fragmented, let's say, vendors of the Health Systems in Europe, because at least in my country there are a couple of vendors. and they are also very active in the field that you're working. So basically, you have not been mentioning in your table with the competitors, but this is also a market which simply has better access to hospitals. So what is your strategy? I mean, we have heard how you're planning to work with the large radiology medtech companies globally, but how you're planning to work on specific markets with the vendors of hospital information systems.
So we have created during the product development process a tool which is called GreatBox. So GreatBox is enabling us to integrate with any existing hospital infrastructure system provider. So we have the competence of integration because one of our co-founders have actually led projects that have been developing products for these hospital infrastructure providers. So in terms of that, we are able to integrate with all of them through DICOM or other solutions.
Thank you.
Any other questions? None? If none, then thank you very much, David, for the presentation. And we are going to continue with real research. So Martin, please switch on your camera and be ready for the questions.
Hello, I'm Marcin Krzykarski. I'm the CEO of Real Research, and let me introduce you to our company. At Real Research, we want to solve the problem of drug development. The cost per newly developed drug more than double every 10 years, and by 2030, it's going to reach about $6 billion, which is unsustainable in long term. Therefore, we come up with our solution, which is a 3D cell culture implemented in very early stages of drug development process. When our clients, Big Pharma, implement our solution at early stages like heat to lead or lead optimization, they will immediately save a lot of money simply by the fact that will be much fewer drugs to test, and at the end, they have much higher chances of really finding the next blockbuster. We measured the market size by a number of publications because the market is divided 50-50 between academia and industry. Therefore, we know that the market is basically skyrocketing. The innovation we are providing is not only the fact that it's a 3D cell culture, which is already used sometimes in those drug development programs, but the fact that we can actually customize the gel and make it almost exactly as it is in the human body. Therefore, the results are much more valuable. What we do is we recreate the scaffold where cells, for example, cancer cells live. Therefore, we match the gene expression profile to be exactly as it was in the body. Therefore, the response to drugs will be much more valuable. This is a case study we wanted to show. So we have taken a human pancreatic cancer cells, seeded them on multiple different types of hydrogels for 3D cell cultures, and we're able actually to show 4 distinct morphologies, which means that those are 4 different types of niches where this cancer metastasizes. And if you're the Big Pharma and your drug is going to work in all of them, this means that you're having really something special, and then it's worth investing in. Our technology can be applied to many different fields, but at this moment, we concentrate on chemotherapy for individual patients and drug discovery research models. In future, we plan to go for gene therapy, lab-grown meat, and very broadly in tissue engineering. IP is fully protected, and we are free to operate. And what's important is that LightGel is not just one hydrogel for 3D cell culture, it is the entire tech platform. And we are building around this platform many new applications and new products. Just to name a few, LightCube, which is an automatic system for 3D cell culture. We have a hydrogel for mesenchymal stem cells, and we are developing our own drug discovery program. We are doing those products mainly in collaboration with other companies like those here, or through non-dilutive funding. The huge benefit of our product is that it is repeatable. It's one of the very, very few highly repeatable hydrogels. It's easily compatible with standard system and degradable. It is customizable, and last but not least, it can be used to stain antibodies, which are one of the biggest tools in drug discovery. It's important because we are actually looking to collaborate with antibodies manufacturer that will be providing our hydrogels to their clients. This is our team, as you see, highly diverse, mainly PhD level and postdoc level people. We are planning to hire marketing and more managers. We have got our seed funding in 2017, and we are ready for growth with an A round that we're raising right now. We've got a very nice growth until the COVID, but now with the new investment, we plan to get back on track and grow again. We're looking for 4 million euro with a small pre-round of about 250,000, and the 4 million will be divided into 2 million depending on the performance, with a 2 million additional funding with a new evaluation after about 2 to 3 years. We are reinvesting everything in growth, and the project operating margin is about 85%, but with right optimization, it's going to be 90, 95 or 98%. Thank you very much for your attention, and I'm excited to hear your questions. Thanks a lot.
All right. Who wants to start the questions?
I can go first. Yeah. Martin, thank you for the presentation. So 2 questions. So first of all, what is your business model? So basically how you want to engage with the clients. And secondly, do you have any initial revenues apart from your products or anything related to any services that you provide? I know, yes, I'm just guessing, trying to guess what you do there.
Yeah, so basically the long-term business model is to sell hydrogels as a tool for research. Although because we are offering I would say a very special product comparing to what is on the market at this moment, we are also providing services. So we provide services for companies to develop the research models for them, and then we're going to sell the hydrogel, the plates with ready-to-use hydrogel already for their own research. But in long term, we basically plan to concentrate on scaling up and manufacturing the gel, simply because that's where the biggest profit margin is.
And what is currently the ratio, let's say, the part of the revenues when it comes to general turnover, when it comes to the services that you provide?
It's majority from services, simply because like the sales that follows after that is usually a medium size or small size test. So we at this moment it's much more from services, although we are also working with contract research organizations, which will actually just concentrate on selling our product, not to just 1 or 2 screens, but rather to like multiple services done by that CRO.
Okay, thank you.
Thank you. Yes.
Yeah, thank you, Marcelo. I mean, you have so much that we could spend hours talking.
Yeah.
It's jam-packed, and including the future vision of all the different initiatives around your Life Gel. That in itself, I think, would take a couple of days to dissect.
Thank you for understanding.
Yeah, maybe my question is, in terms of the 3D cell cultures, where are you in terms of validating your offering with pharmaceutical companies and research companies? What's been the reception you've received so far? And how far away are you from likely future partnerships?
Yeah, so this is really a great question. I've been working on it for the last 2 years, and we have been in touch with Big Pharma, and they were always asking about exactly about that. What is the validation level? And this is a part of the strategy we started a long time ago, like back in 2018. We actually planned to. The strategy was to sell the product at a basically lower price to academia to generate as much data as we can, simply because there are so many different topics that we were not able to do it ourselves. And one of the things I also observed on the market is that there are other companies that are doing similar things, and all of them went the same direction, and none of them really succeeded comparing to the main competitor. So all of them tried to do their own publications, which basically gave them some kind of recognition, but not really much. So our strategy was different, just to make more publications, but allow other people to do that. Now we realized actually that even the academic clients, they really need that initial publication. So I see a benefit of what we have done, because we actually got to clients earlier. We've got the industrial clients much earlier, but we didn't get that broad use across academia, which as a result did not produce the data that you're asking for. So then when talking with academia, we actually had to face the same question and saying, well, we don't have that hardcore evidence yet. So this is why actually in the new investment we are planning to invest a lot in finishing our own research. So we actually have done quite a lot of research that will be very useful for big pharma and for academia. And we're going to solve this problem simply by finally publishing all of the things that we have done, and also by basically investing in collaborations that we managed to start so far. So the answer is we don't have it yet, but we have a very clear plan how to be there in the next 2 years.
Okay, thank you. Can I ask you one final question? How
Yes,
strongly do you believe in your offering, your product?
I put everything into the product and the offering, so I do believe totally in this.
Thanks.
Thank you.
Any final questions from the investors or jury? Sorry. If not, then thank you very much for the presentation. And we are going to have our final presentation from Wewell. Just 1 second, then I'm going to share my screen. And then it's going to work. Right.
Hello, everybody. I'm pretty sure at least once you stop in front of cosmetic shelf in drugstore trying to figure out which would be best fit for you. I can tell you from my experience and many others, it's not easy. My name is Gurami. I'm co-founder and CEO of Wewell. Wewell is a personalized cosmetic shopping assistant that helps people to find the best cosmetics available based on their skin type and skin conditions using deep learning AI. The idea actually popped up when our wives came to us with a request to build a tool to make their cosmetic shopping easier and effective. Because most of the time they were purchasing cosmetics without knowing what risks its ingredients had. Often they purchased wrong products for their skin type and had to buy another and spend more money on that. As in most cases, opened cosmetics are not refundable. And they weren't alone in this actually. Most of their friends have these issues as well. So we dived deep and found out that the current customer buying behavior is quite often to purchase expensive products not because of quality, but due to the marketing, brand name, or basic packaging, or how it looks like. Why is that? Because of the ingredients, right? They are often too complicated, a lengthy and profound knowledge of the chemicals. 88% of cosmetic buyers are unaware of contained ingredients that might be toxic, harmful, or risky for their health, or even nature. And things become even more crucial should they cost their kids. Moreover, one mistake in choosing a product may cause the customer an allergic reaction. So why does it matter, right? Because the market opportunity for us is huge. The cosmetics industry is one of the biggest in the world, and the global market for natural and organic cosmetics is peaking at the moment, which identifies the massive interest of customers purchasing the products using natural and low-risk ingredients. According to the American Academy of Dermatology, acne is one of the most common skin disorders in the US, affecting approximately 50 million individuals every year. So as a solution, we are building a mobile application that synchronizes cosmetic shopping experience with skin quality recognition. With the help of the AI, customer can analyze its skin. For example, if they have acne, wrinkles, or others, and then once they are shopping, we will take this data into consideration and recommend that the products that will be beneficial for their skin and their skin only. So within just one scan of the cosmetics barcode, we will match the information about their skin health with the cosmetic products ingredients and help them to choose the right one for their largest organ skin. At this stage, the business model for users is free. However, as an extension for revenue model, since we are creating a comprehensive anonymized user profile based on the user's scan history, we want to offer businesses in the health and beauty sector to advertise and better tailor their campaigns. And secondly, and most importantly, we want to offer users the most trusted marketplace that is in sync with users' health, so they can purchase the cosmetic without leaving their comfort zone home. There are several other companies doing something similar to what we are doing, and some of them are doing a great job. But when it comes to the personalization, our direct competition struggles. We are providing personalized evaluation of how it matches user skin health, not just giving them information about the product and its ingredients. So the user can finally stop wondering and best guessing which cosmetic best fits for them. Our team is highly experienced in delivering such technology. Our CTO, Vladimir, is a senior entrepreneur with 10 years of technical experience in creating softwares for small and medium-sized companies. I focus on growth and management in Wewell, have 7 years of software engineering experience and 3 years of international experience building tech companies. And this is my second startup, actually. We have cumulative experience working together, me and my co-founder, for 4 years. We have went through a couple of rounds of acceleration and have an amazing team, including experienced biotech engineer with superpowers, cosmetic ingredient specialists, and more importantly, we have our community by our side, which helped us to test the product, and we were the ones giving amazing feedback about improvements and missing features. Influencers in our community were helping us with sharing the application with their audience without us asking them to do it, which is awesome, and we are really grateful for being a part of. We believe that everyone, such as you and me, should know what cosmetics are we buying, how it would affect our skin. On close beta testing, we gained 4,000 users, and can you imagine what we can do after we launch? We are currently raising our pre-seed round, and if you share the same values, join us on our journey. Thank you very much.
Right. Any questions? And hi, Grammy.
Hello, hello.
Daren?
Hi. Quite interesting. I can see obviously the marketplace here for being able to personalize cosmetics, and I can also see your future business model in developing marketplace, obviously point of contact and then purchase. I'm just questioning on the medical utility of the application. To what extent is this a diagnostic tool for skin conditions or not? And to what level are you also collaborating with dermatologists to help to support and validate the recommendations that you're giving?
Great question. Thank you very much. Hello, everybody, once again. So let me answer your question. Firstly, we are currently not medical device application, and we are not intend to become one because it creates really obstacles for us, and we are not here to diagnose any disease or else. We are just using the personalization has two layers, right? The first one, what we are asking the user is the questionnaire, right? The questionnaire is fully conducted with the help of the dermatologist, and we are actually simplifying the questionnaire. So it's simple for them to fill it up, and we will detect whatever the user knows about their skin, right? And the skin analysis will be like the additional feature. For example, if the user will say, hey, I have an acne, it's easy for them to actually detect if they have pimples or so on. So we will detect what kind of level is the acne, right? Either it's like level 1, level 2, or 3. If it's 3 and it's not really in our hands, we are recommending them to go to the dermatologist and get treatment for it, right? But if it's down to that, we can actually synchronize that. So we personalize the full cosmetics experience to them, and we are kind of improving this shopping layer. So that's how we are building this. But with the dermatologist, we will have a huge partnership with them. So we can either offer to go to the dermatologist or do the collaborations with the labeling part of our AI, which is crucial for us. And yeah, that's our plan.
Great, thank you very much.
Yeah, no problem. Thank you.
Vit?
Hello, Gurami. Thank you for the project. Good work, because I believe in the cosmetics. There is a lot of money, so it's a nice sector. Anyway, I would like to ask you, how do you plan to get under the skin of your clients? Meaning, like, what is your go-to-market strategy, and in such competitive market, how you want to penetrate and how you want to beat the others?
Great question. Thank you very much. So our go-to-market strategy is first to try to gain the reputation in the markets, right? And how we are going to do that is through the influencers. From the day one, we started to create our community. That's the essential part of doing B2C application and just communicating this direct to the customers, right? The second one is that we already have influencers. We are not paying them, and they are really seeing the value of what we are bringing to them and to their followers. So we want to continue that, and we want to collaborate with nano and macro influencers in the future, because we see that we can really identify what kind of segments are we focusing on. If they have, like, let's say the influencer have like 10K subscribers, we can actually assume that these 10K subscribers either they're like following like different industries, like let's say food or lifestyle, or we are having the customers from the cosmetic area, and that's how we will understand which we have to follow later on. And why it's good to reach out from the influencers, because the people trust influencers. They don't trust us right now, but they trust them. So if we reach them, it will be easier to gain the trust, and then we can approach with our direct marketing, which will be social media campaigns. So that's our first, and plus we are implementing the referral systems into our application, because we see that people are sharing with their friends. So we want to reward them with that, and in our upcoming versions, where we will have like the premium subscriptions already rolled out, we will reward if they will invite 5 of their users to the application and give them like 1 month of free subscription. So that's what we are doing right now, and how we are gaining the presence on the market.
Thank you.
Any final questions from the investors? If not, then thank you very much, Gurami, for the presentation and for answering the questions.
Thank you very much for providing the program. It was really helpful. I would just like to underline that. And thanks to Olivia. Thank you very much.
Thank you very much. And I would like to ask Sergey from DeepTrait to say a few words.
Thanks, Olivia. Can you hear me?
Yes, I can hear you.
Awesome, thanks. So my name is Sergey. I'm the co-founder and CEO of DeepTrait. We work on emerging technologies, whole genome sequencing and modern artificial intelligence to create a new market of data-driven molecular biology, genetic engineering, and breeding. We decided not to pitch today since we're not fundraising right now, though we would be happy to get in touch with companies working with microorganisms such as yogurt and yeast producers or vaccine and antibiotics manufacturer. So instead, I would like to take the occasion to thank the V4 program organizers for all the wonderful input, and especially Gregor for super insightful mentoring sessions, and also Sophia for flawless organization of every stage of our participation. Thank you very much. We appreciate it a lot. We wish the best of success to all the participants and are looking forward to the bright future of the innovation ecosystem in the region. Thank you.
Thank you very much, Sergey, for the nice words, and wish you also the best of luck. And thank you very much for all the companies again for pitching. I will switch on my camera. Thank you so much for pitching and for preparing all the presentations and for all the hard work. And also a big thank you to all of you, because for many weeks, Greg and myself, we're having a lot of one-to-one sessions with you, sometimes a bit shorter, sometimes quite long. And often very intensive. A lot of brain work was put into these sessions from both sides. And I think seeing the before and after, if I can say something like this, it's quite impressive. So a huge congratulations to everyone who was participating in this program. And again, a big thank you for the Visegrad Fund for sponsoring this program and for paying for it. And also thank you very much for all of our partners who have been working with us together to create this program. And also thank you very much for the keynotes speakers of today as well, and for dedicating your time. And I would say this was it from today's event.